everyone, I'm Dr. Evelyn from Petsadena Animal Hospital. Today let's talk about coughing. We all know what a cough is, however there's different causes for coughing in dogs and cats. Coughing can be caused potentially by an infection, whether it's an infection of the upper respiratory tract, like a head cold, or possibly an infection in the lungs, like something like pneumonia. Other reasons for coughing could include some type of inflammatory process like a bronchitis. In cats, we see a condition called feline asthma, which is an airway inflammation that's similar to asthma in people. Another reason for coughing, specifically in dogs, is a condition called collapsing trachea that we see fairly commonly in small breed dogs. While collapsing trachea sounds like a scary condition, most of the time it can be managed, but in rare instances it can be more serious. Coughing can also be related to a heart condition. Different heart conditions can occur, whether it's something that a pet was born with, a congenital condition, or a condition that happens over time as they get older, a degenerative condition. Heart disease is something that we worry about in pets where we potentially hear a heart murmur when we listen to them and perform an exam, or in a breed that might be more predisposed to heart disease. When it comes to heart disease, we can usually perform diagnostics here at Petsadena or at your general practice that can give us some information about the heart. However, in order to get a more confirmed diagnosis and more specific treatment recommendations, we do talk to you about going to see a specialist, a heart specialist called a cardiologist. One of the more common reasons for a cough in dogs would be an infection of some sort. Most of the time an upper respiratory infection with a bacteria called Bordetella. Many people know that as kennel cough. Since an infection is a possible reason for coughing in dogs, it is important that you isolate your dog away from other doggies until we've confirmed the diagnosis and also till they complete treatment. For cats, one of the more common causes for coughing is the feline asthma that I described, or feline bronchitis is another name for it. That's an inflammatory process and typically is not contagious. Cat coughing can be tricky because it can actually look similar to when they're trying to hack up a hairball. However, typically with cats that have feline asthma, when they cough, they don't tend to produce anything. They don't tend to cough anything up. So if you're not sure of whether or not your cat's hacking up a hairball or coughing, it's always important to have your cat be seen by a veterinarian. And if you can, take a video of your cat's episode so that you can show it to your veterinarian and can better characterize the episode. If your pet comes into Petsadena with a cough, typically we're going to perform a thorough examination to assess for potential causes for the cough. That usually includes making sure we take their temperature. So if they have a fever, that might be more of a sign of infection. We'll listen to their heart and lungs, such that if we hear some abnormality with the heart, that might point us more to heart disease as a possibility. And if we listen to their lungs and we hear an abnormality in the lungs, that might point more to a lung issue and the need for an X-ray. After performing an examination, your veterinarian will then determine the best diagnostics to determine the cause for the cough. The most common diagnostics we tend to perform to further assess a cough include X-rays of the chest, because they allow us to look at the heart and lungs at the same time. If we suspect infection as a possible cause for your pet's cough, we can perform a panel that checks for different viruses and bacteria that could cause a respiratory infection. Sometimes your veterinarian might recommend blood tests to look for any changes in the white blood cells that might suggest an infection as well. If we suspect heart disease, then your veterinarian may recommend additional diagnostics, including an EKG to check the heart rhythm and check for changes in the heart, blood pressure to check your pet for high blood pressure as a reason for a heart condition, and we can even perform a blood test that will look for a heart muscle enzyme that is elevated if there's increased stretch or stress to the heart muscle. If we suspect heartworm disease as a possibility, then we'll recommend a heartworm test to further screen for heartworm disease. When it comes to feline asthma or chronic bronchitis in dogs, typically we'll recommend that your pet see a specialist for advanced testing to further diagnose those conditions. Let's talk about treatments. Now, once we diagnose the cause for your pet's cough, we can then guide treatment based on the diagnosis. If there's an infection, we'll recommend antibiotics. If there's inflammation in the airways, sometimes we'll have to use steroids to treat that. If there is possibly a collapsing trachea issue, we might recommend cough suppressants and other lifestyle changes to manage that. So depending on what we find with our diagnostics and our exam, we can then guide the treatment to a specific cause. Your veterinarian will give you more information on whether or not to isolate your pet if they suspect infection or diagnose that, or long-term management if it's a chronic condition we diagnose. Thanks for choosing Petsadena.